Our concern for how we look is directly reflected by our self-confidence and the image which we project to others. This image can have an effect on the success of both our personal and business lives. Hair loss can provide an adverse effect on our image, but medical science has provided a safe, proven technique to correct this condition. Devoting much time and great effort to the field of hair transplantation, Dr. Larry Fremont has applied his skills in this field for more than 5 years. During this time, Dr. Fremont has performed over 40,000 separate grafts and numerous scalp reductions. Since prehistoric times, hair has been an important part of life. In ancient times, Assyrians used wigs to hide baldness, and the first known hairdressers were ancient Greeks. The Romans used hair from captured blonde women to adorn their heads, and it is said that Louis XIV of France used a wig to make him look taller. Even today, wigs are used in many courts of law as status symbols. Such a preoccupation with the state of hair has spawned the modern replacement techniques used today.
Most doctors agree that the male hormone testosterone, with the genetic predisposition to baldness, causes hair to fall out. There are 4 methods of dealing with this problem: the hairpiece, hair weaving, hair implanting, and hair replacement surgery. Although all methods are used, some are more advantageous than others.
Tony, how long has it been now since the procedure was performed?
It's been approximately about 3 years.
Now, was there any one or any particular thing that really got you motivated, made you want to go through with it?
I just missed my hair. I missed it. I certainly missed my hair. And I couldn't see myself wearing a wig. To me, it's like wearing a hat. I wasn't too keen on wearing hats. So this is permanent. It grows. I pay my $10 a month for a haircut.
The most advantageous method is hair replacement surgery because it utilizes your own hair. In the hair transplant procedure, your hair is taken from the fringe area and moved into a balding area, where it grows at the same rate as the rest of your hair and needs no further replacement. Many times, surgeons will use scalp reductions, bilateral scalp lifts, and other advanced procedures in conjunction with your hair transplant.
Now, obviously, you looked into the various procedures that were available to you. Something made you decide on this particular procedure.
Well, I didn't, like I said, a wig is like wearing a hat. So I wanted something permanent that I didn't have to worry about. And the transplant was the answer for me. I just wanted to make sure that it worked. And I had seen other patients, and it convinced me. It looked very natural. It is your own hair.
After a routine preparation and local anesthetizing of both the donor and the recipient areas, healthy grafts of your own hair, genetically coded to live and grow for your lifetime, will be transplanted to thinning and balding areas called the recipient sites in a design that closely matches the angle, direction, and pattern of the original hair. Each transplant usually includes 10 to 15 hairs, and in some cases up to 35 hairs, depending on the density of the donor hair. The circular graft is about 4 millimeters in diameter and only deep enough to ensure that the living hair follicles in the skin are included. Only the skin, not the deep underlying tissue, is involved in the donor and recipient sites. The transplants are carefully spaced in the recipient sites to allow an adequate blood supply to reach each one during the healing process. The intervening areas are filled in with additional grafts 6 weeks after the initial transplants have healed.
Amos, have you noticed any change in the donor area?
No, not really. As you can see, this is basically the area that they took the hair from. And again, it's not really, I mean, nothing, no evidence of whatsoever.
It's not visible at all.
No, I don't have to cover. It's just not visible. The operation does in a way which not leave any options for this to be visible. So it's not a matter even of covering or doing cosmetic, it's just not there.
This area at the lower back and sides of the head from which healthy permanent transplants are taken always heals quickly.
The small donor areas, which are closed with sutures, are almost undetectable and are soon covered by the surrounding hair. These areas cannot become bald. After the donor areas are sutured, the fringe area looks the same as it did before the removal of the grafts. During the healing period, the hair above the donor areas can be combed over to conceal the sites. Therefore, it is suggested that you do not cut your hair in this area for several weeks before your procedure. Elective surgery for one's improved physical appearance is universally accepted and performed where there are qualified specialists. Hair restoration procedures differ from general surgery, however, in that they involve only the outer layers of the body. You should not worry excessively about risks or complications because they are very rare. If you were to be accepted as a patient, it would be extremely unlikely, based on extensive experience, for any serious complications to result from such surgery.
For me, the greatest thing was the fact that I knew that I would never ever be bald because I could take care of the problem before it happened. And in essence, people don't even know that I had it done. So that's the other sort of benefit, that I'm doing something, I'm sort of fooling everyone. They won't know.
So how do you feel?
I feel great. Just delighted that I had it done, and like I said, I'd recommend it to anybody because it's a wonderful feeling to maintain your looks.
Show me where it was done. Just ruffle it up, Gary. Go ahead.
Here, in here.
Surgeons consider hair transplanting to be a minor procedure.
It is done in the doctor's office, and there is almost no likelihood of any serious complication. Most patients compare it to a dental procedure. After the anesthetic wears off, there is some mild discomfort, but most patients don't even require pain relievers.
If the patient has a knowledgeable and competent surgeon, the success rate is excellent. For example, Richard Simmons, Hugh Downs, and Roy Clark, they have all had hair transplants. There has never been a reported case of transplanted hair falling out because the fringe area is genetically programmed never to fall out.
Now, if a very close friend was going bald, what sort of advice would you give him?
Well, I would advise them to do what I did. I would go and talk to the doctor who did the transplant and see what he could do for them. If my friend was in the same situation as I was, I would advise him strongly to get it done as soon as possible so that it wouldn't be too late and then it would look bad once they started getting it done. So that's what I'd tell them to do. Go ahead and check it out and do it now, not 5 or 10 years from now.
Not everyone is a good candidate for hair transplants. Those with a small fringe area, combined with total baldness, would do better with a hairpiece.
But most interested patients are good prospects for hair replacement surgery. A recipient of a hair transplant once said, "I believe that having hair is like having a shine on your shoes at a wedding. It isn't essential, but it's certainly preferable."
All of the procedures involved in your hair restoration are considered to be minor surgery, and we do everything possible to limit the interruption of your usual activities.
Amos, I have to ask you this. Are you now having fun styling your hair?
Yes, definitely. I feel great. You know, I feel 19, 20 years old. really gain a lot of self-confidence. It's really terrific. I'm very happy.
Is any special care now required?
No, I'm doing what I used to do before, with one difference. Before, I didn't have hair to take care of. Now I'm shampooing and I'm doing exactly what basically everyone does with his own hair.
After your transplanted hair has grown to sufficient length, you can style it in almost any manner you wish. It is your hair, and it can be cut, combed, brushed, curled, or styled in any fashion which suits your lifestyle.
Since we're talking about scalp hair, I think we should take some time to know about some of the factors which affect it and how it is produced. The first thing that you should know about your hair is that proper hair care should begin early on in your life. There are so many factors which affect it: air pollution, drugs, disease, stress, nutrition, dyes, perms, combs. Therefore, proper care should not be neglected. As seen in this chart, in the anagen phase, hair grows at the rate of 1 centimeter per month. If it wasn't cut for 10 years, your hair would reach past your lower back.
Spin on the ball.
Now, the average healthy scalp contains about 100,000 scalp hair follicles, which, depending on the base, will be divided into various growth-arresting periods. Color depends on pigmentation at the hair follicle. Red hair has a chemically distinct pigment thought to contain iron. Blondes have about 140,000 hairs, and brunettes have between 110 and 120,000 hairs. Redheads generally average between 80 and 90,000 hairs, and red hair does tend to be coarser. Now, every man experiences some degree of male pattern baldness during his lifetime. Perhaps 25% of men to age 25, 50% of men to age 50, and so on, will have significant hair loss which increases in severity with age. There will be periods of heavy hair loss, and at other times the hair loss will be scarcely evident. It is, however, always progressive, and it is always permanent, so that from the very early stages of hair loss at the temples or crown areas, the loss continues after a number of years until all the hair roots have become lost, leaving only hair at the back and side. The degree and rate of hair loss will depend on the inherent tendency of the individual, and only slightly on environmental factors such as tension and anxiety. It has been conclusively shown that the male hormone testosterone must be present for the balding process to occur. Lack of it, such as in eunuchs, will prevent this form of baldness. The back and side hair is not sensitive to testosterone and therefore does not take part in the balding process. Although there is no successful medical therapy for this common baldness, good physical and mental health, as well as the use of good products on your hair, is all that one can do to prolong hair life. Only in cases of severe hair loss, where a suitable donor area still exists, can hair replacement surgery be applied. Now, there are two types of hair, vellus and terminal. Vellus hair can be described as fine, hypopigmented, and peach fuzz-like, as on the forehead and bald scalp. Terminal hairs are relatively coarse, long, and usually pigmented, as on the normal scalp. Vellus facial hair is developed into terminal beard hair during male adolescence, or female hirsutism. Terminal scalp hairs involute into vellus hair, as in the androgenetic alopecia or male pattern baldness. The production of hairs by the living cells is cyclical in every hair follicle. Now, during the relatively long growth phase called anagen, The cells divide and become keratinized, producing hair shafts. During the short, typically 3-month resting phase called telogen, cell division stops and hair growth ceases. The attachment of the hair to the base of the follicle weakens. Finally, the old hair is shed by gravity, a push from a new growing hair, or traction from combing and brushing. There are different and characteristic growth cycles for terminal hairs for the eyebrows, for the scalp, pubic, and body areas. These differences account for the different hair lengths. Resting and growing hairs are randomly distributed throughout the scalp. Approximately 10 to 15% are in the resting stage, and the rest are in the actively growing stage. With approximately 100,000 growing hairs on the scalp, there is a random shedding of 50 to 150 hairs daily. Normal shedding is seasonally increased in the fall and decreased in the spring in the north temperate zone. If shampooing is not performed daily, it is accompanied by increased shedding because it harvests several days of accumulation of the inactive hairs. Androgenetic male alopecia, or male pattern balding, is the most common type of hair loss in both sexes. It occurs only in scalp follicles with the genetic potential to be inhibited by the male hormone over time. The first and foremost consideration of the surgical approach to male pattern baldness is the proper framing of the face in an aesthetic and natural manner. The aesthetic function of hair is to provide a complementary balance to the other facial structures, so that the eye is neither drawn towards nor away from any single feature, but perceives the entire head and face as a pleasant, natural, and balanced whole. The most important goal of surgical hair replacement should be to reestablish the aesthetic balance that was lost in the balding process. Well, now that you know a little bit more about your hair, let's examine some of the procedures for correcting hair loss. There are two methods of correction: hair transplant and scalp reduction. First of all, let's examine hair transplanting.
Okay, Bill has a high forehead now, and we'd like to conceal the grafts. So what we plan to do is put the grafts in higher up from where the hairline is eventually going to end up. And that way, he'll be able to use his own hair to cover these grafts until they start to grow. In the next stages, we'll advance the procedure down to where the hairline will eventually be. So this is what we're going to attempt to do now.
The prerequisites for successful hair transplantation are adequate donor hair and good health, not age. The hair on the back and sides of your head is genetically programmed to grow for your lifetime. Successful hair transplants have been performed on men from 19 to 80 years of age. Hair transplantation sounds a bit like a gardening procedure, and indeed it is. Just as healthy flowers can be uprooted from one plot and transferred to another, so can a man's hair be taken from one fertile area of his head and planted on a balding area. If you want to be technical about it, hair transplants are really scalp transplants.
This is the recipient area here, and we're going to remove bald plugs of skin. And from the back, we're going to take grafts and move them into these recipient holes that we're making. These holes are going to be 3.25 millimeters in diameter. Okay, I'm putting some saline into the tissues here to increase the turgidity. You can see how it's ballooning it out. Now that saline will be rapidly absorbed, so I'll have to do it several times through the procedure. This allows the hair to stand out. Now we're taking our first grafts. First grafts, we're going to take 6 down. 3 rows of 6. Stay.
Small pieces of the scalp called grafts, each containing a number of hair follicles, are removed from the donor area, usually near the base of the scalp. Then, small pieces of the balding scalp called plugs are removed so that the grafts can be reset in their place. Soon after surgery, most of the transplanted hair falls out. This is normal, as the trauma of transplantation causes hair roots to become dormant for a period of time. But gradually, the new hair will begin to grow, and within a year, the full effects of the transplant will be visible. Surgical skills and art are equally important parts of the total procedures used to recreate a new head of hair, which is uniquely right for each patient and fits his age, personality, career, and lifestyle. If the doctor determines that hair transplantation is for you, he will recommend the design for your restored hair pattern, subject to your approval, of course. It has been found that men of all races can incur male pattern baldness. In a relatively small number of cases, however, there are men who, for one reason or another, do not make acceptable candidates for hair transplantation. These men are not treated, nor should they be treated. If yours is an unusual case, or Dr. Fremont concludes that you will not be a suitable candidate, he will explain the reasons for his opinion.
Now, Amos, was cost a consideration?
Yeah, cost is a consideration, but weighing the results, looking on the long-term effect of the operation, cost for me is not a factor. Now, it's not a cheap operation, but again, the long-term results and the fact that, anyway, in my case, I was able to pay, gradually and for a good 7 to 8 months, so it didn't affect me at all.
Do you think that cost should be a consideration?
It's a difficult question to answer. It depends of the situation. It depends of situation, economic situation of every potential client. But again, I'm saying, you look on yourself, you look in your life, you look at what it does for you. Compare it to a cost of car, to cost 15 times going on a fancy restaurant and stuff, and then you will say it's no comparison. The way I feel today, the way I'm going to feel in the future, if you weigh that, cost is not a factor.
Costs of transplanting are usually determined on a per graft basis. The number of grafts which you require is determined by the extent of your baldness.
Transplanting is obviously a time-consuming and very expensive process, so it is often performed in stages. Some men don't have enough hair to spare. When hair loss is advanced, transplanting can only result in skimpy, widely spaced tufts of hair, since the sources of supply are obviously diminished with each and every graft transplanted. If you have male pattern baldness, it is quite possible that your donor area will not have enough hair to adequately fill in the balding area.
At a recent international conference on hair replacement surgery, a number of interesting points emerged. For a start, despite all the money spent on research, there is no medication or lotion which can produce a full and satisfactory head of hair on men and women. The other interesting thing that was discussed was the mini grafts. This is a technique using smaller and finer grafts than the traditional grafts. This gives a much better cosmetic effect, and it's particularly useful for women because women with thinning hair can achieve, through this process, thicker and fuller head of hair. The other interesting issue was the technique of scalp lifting. This is being widely done by leading hair transplant surgeons nowadays. In this technique, a much larger area of scalp is removed, therefore less surgery is required. Also, you get a much better cosmetic effect and the hair falls into place much more naturally. All in all, I would say that this is an interesting and exciting time in the area of the treatment of baldness.
In 1978, a routine procedure, long used in plastic surgery, was applied to male pattern baldness. It was named scalp reduction. And just as the name implies, it is a procedure in which the bald portion of the scalp is removed by safe surgical excisions. The scalp is very elastic in some individuals, and it is possible to just cut out an area, loosen the edges, and pull the hair-bearing sides closer together. This can be repeated at 8 to 12-week intervals. And by this method of pull, sometimes the entire area of baldness is removed.
We have shown you the techniques available and some very astonishing examples of changed lives. It is obvious that hair loss can be corrected in most cases, so the rest is up to you. The fact that you are watching this program means that you have taken the first step in making this decision. Congratulations.